I got lipo, then got pregnant right after, and this how my stomach turned out because I didn't get my massages.
Okay, so I was sent this video by a follower, and I think it's really interesting, and I'm so glad she shared it. And I just want to start with, do not go find her and be mean. If you go to her page, be nice and supportive. So it looks from her videos like she had body contouring and then got pregnant unexpectedly shortly after having the surgery. And the abdomen, the stomach that you see there is the result of weight gain and stretching with pregnancy. So people in the comments are not being nice. They're scolding her for getting pregnant. It happens, guys, relax. And they're also saying that she didn't do things right after surgery, like having lymphatic massages, but that's not at all what's going on here. So although lymphatic massages are amazingly helpful for keeping things as smooth as possible, whether or not you do them is not really what affects this. So whenever we do liposuction and we remove fatty tissue, we're also creating scar in the area. So if you gain weight in the area and the fat that's left behind gets bigger, the scar tissue pulls in, and that's what leads to this kind of lumpy, bumpy look. Now, the way that you had the liposuction done and the aggressiveness is also going to potentially increase the chance of this. So when we do liposuction, it's always prudent to leave a healthy layer of fat right under the skin because that leaves the scar tissue lower. And if anything like this happens, you have a healthy layer of fat potentially that hides it a little bit better. So if you have really aggressive liposuction where they take a lot out close to the skin, this is going to be a lot more visible and a lot more common with weight gain. So what do we do? So in general, you want to, of course, wait. Tincture of time, getting back to your normal weight is always the best first step because a lot of that will get better when you get back to your normal size. Now, if you have residual lumpiness and bumpiness, this can be very challenging to fix. So one thing that we often do is fat grafting. So if you just have little areas that are depressed, we can actually do some fat grafting to try to smooth the area out, or even targeted liposuction in areas that are a little bit too prominent. So it's kind of a plus minus thing. You remove fat in some areas, put fat back in other areas, but it can be very challenging. Another option is to do a tummy tuck, lift everything up, and you can often smooth things out that way and pull it back down. It recurs though. I hate to be the one to break this to you. So you'll see people show a revision of a stomach like this where they do a tummy tuck and they'll show you a beautiful after with no lumpiness. It's always right after surgery. If you wait to 6 months, it tends to come back, but it's almost always less. So I always appreciate when people share things like this because I believe people deserve accurate information, and sometimes it's good to have a visual for what potentially could happen when you do something that we recommend you don't do, like gain weight or have a pregnancy. It happens, be kind, and always remember that super aggressive body contouring, this could be in your future. So it's often prudent to do things in a bit less aggressive way in order to make that less likely.